Welcome to this educational program. This module provides an introduction to oral medications or pills for erectile dysfunction. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This material is independently produced, and the mention of any drug or medical product does not imply its endorsement. If you are prescribed a medication mentioned in this program, viewing the program does not substitute for reading the package insert that comes with your prescription or sample. Hopefully, you will already have viewed the presentation entitled Understanding Erectile Dysfunction. This module is focused on oral medications for ED, but will first review some normal anatomy of the penis, describe how erections occur, and briefly introduce erectile dysfunction. A more detailed description of pills for ED is then given, including how they work, how to take them to maximize their effect, and what the potential side effects and risks are. The penis contains two chambers, called the corpora cavernosa, or erectile bodies, which run along the length of the penis and attach to the pelvic bones. Between the two corpora cavernosa runs the corpus spongiosum, containing the urine channel called the urethra. The corpora cavernosa contains spongy tissue made up of smooth muscles, fibrous tissues, veins, and arteries. Spaces called sinusoids within this tissue can fill up with blood during erection and expand the corpora dramatically. All of this tissue is surrounded by a fibrous coating called the tunica albuginea. Erection begins with physical or mental stimulation, or both. Impulses from the brain and local nerves cause the muscles of the corpora cavernosa to relax, allowing blood to flow in and fill the sinusoid spaces. The penis expands as it fills with blood. The tunica albuginea helps trap the blood in the corpora cavernosa, maintaining the erection. Erection is then reversed when blood vessels in the penis contract to stop the inflow of blood and open outflow channels. Simply put, erectile dysfunction is the inability to get or maintain an erection good enough for intercourse. It is also commonly referred to as ED, erectile difficulties, or impotence. ED can range in severity among individuals. For some, it may be just inconsistent erections. For others, erections that are too soft to penetrate for intercourse. Others may experience early loss of erections, while still others may achieve no erections at all. Interruption with any of these essential steps in the erection process can cause ED. This includes loss of stimulation to start the process, poor nerve transmission of this stimulation to the brain and back to the penis, poor blood flow into the penis, hardening of the penile tissues, or an inability to contain the blood within the penis. Poor blood flow to the penis, caused by narrowing of the small blood vessels, is by far the most common medical cause of ED. Pills to treat ED are designed to improve the flow of blood to the erectile tissue. This slide lists some of the specific factors that may lead to ED. Those listed on the left can all contribute to narrowing of the small blood vessels to the penis, and many of these factors are controllable through lifestyle changes. ED can be treated at any age, and many treatment options exist. The best treatment varies depending on an individual's situation, and your doctor will use all the information at hand to choose the best treatment for you. Treatment options include lifestyle changes, adjusting medications, psychotherapy such as counseling and behavior modification, oral medications or pills, topical medications such as creams and gels, vacuum devices, injection of medication into the penis, and surgery including penile implants or prosthesis. This presentation focuses on oral medications or pills for ED, while other modules are available that review some of the other options in detail. All patients should strive to introduce lifestyle changes which may improve the quality of their erections and all other aspects of their sexual function. These include smoking cessation, an exercise program that emphasizes cardiovascular conditioning, improving dietary habits, and weight loss. Finally, couples should take time to focus on their relationship and make changes where necessary. Beyond lifestyle changes, oral medications have become the mainstay of initial treatment for ED. 3 medications now dominate the market for ED treatment: sildenafil, or Viagra, vardenafil, or Levitra, and tadalafil, or Cialis. All 3 of these fall within a class of drugs called PDE5 inhibitors, as they block an enzyme in the penis called phosphodiesterase 5 to improve blood flow to the erectile tissue. By blocking PDE5, these drugs enhance the normal erection response, allowing more blood to flow into the penis during sexual stimulation. It is very important to understand that taking one of these pills will not affect one's sex drive, and they do not by themselves produce an erection. As they only enhance the normal response, one still needs mental and physical stimulation to achieve an erection. These medications have become widely recognized and prescribed for good reason. As a general rule, they are a very effective treatment for ED. Exactly how effective they are depends on both the underlying cause of the problem and how one defines success. Overall, for all types of ED, about 60 to 75% of men will achieve erections good enough for intercourse with PDE5 inhibitors. Another important point to understand is that these medications do not reverse the underlying cause of the problem. Men with ED must continue to work on lifestyle changes, control chronic medical conditions, etc., in order to prevent ongoing worsening of their condition. Men with ED must continue to work on lifestyle changes and control chronic medical conditions, etc., in order to prevent ongoing worsening of their problem. This table highlights some of the key features about how to effectively take these medications. Sildenafil, or Viagra, should be taken about 30 to 60 minutes prior to anticipated sexual activity, and its effects may last for up to 24 hours. This does not mean that an erection will be sustained for this entire time. Rather, that it may still be in the system during this time to help enhance the normal erection response. A second dose should not be taken within this 24-hour period. The effectiveness of Viagra may be hindered by fatty food and alcohol. Vardenafil, or Levitra, should be taken 25 to 60 minutes prior to anticipated sexual activity, and its effects may last for up to 4 to 5 hours. A second dose should not be taken within 24 hours of this previous dose. Levitra is not affected by food or alcohol. However, excessive alcohol will affect any man's ability to have an erection. Finally, tadalafil, or Cialis, should be taken 30 to 60 minutes prior to anticipated sexual activity, and its effects may last for up to 36 hours. A second dose should not be taken within 36 hours of the previous dose. Cialis is also not affected by food or moderate amounts of alcohol. Viagra is typically prescribed at 100 mg doses. However, 50 mg tablets are also available, and your doctor may choose dosages ranging from 25 all the way to 200 mg depending on the situation. Levitra is usually prescribed at a 20 mg dose, although 5 and 10 mg tablets are also available. Cialis is also typically prescribed at 20 mg, and 10 mg tablets are also available. Your doctor will choose the dose that is best for you. If you are not achieving the effect you desire, talk to your doctor about adjusting the dose. You should not do so yourself without first discussing it. The most common side effects of PDE5 inhibitors are headache, flushing, heartburn or indigestion, and nasal congestion. Allergic reactions such as skin rash are uncommon. These medications can cause visual changes, and you should not operate a motor vehicle if you experience these effects until they subside. Levitra is the least likely to cause these changes. Cialis can uncommonly cause flu-like symptoms, back pain, or muscle aches. There is a misconception and fear among some men that PDE5 inhibitors cause heart attacks, and this is certainly not the case. The next few slides aim to clarify the relationship between these medications and heart problems. Firstly, PDE5 inhibitors do not cause heart attacks. The more important question to answer first regarding heart safety and using ED medications is whether or not your heart is fit enough to allow you to engage in sexual activity, regardless of how you achieve an erection. If you have any questions about your exercise tolerance or your suitability to take ED medications, talk to your doctor. There is also a myth that men with high blood pressure should not take ED pills, and this is also not the case. It is true, however, that certain blood pressure medications may need to be taken into consideration when prescribing PDE5 inhibitors, especially a class of drug called alpha blockers. Again, talk to your doctor if you do take medication for high blood pressure. The most important thing to understand in relation to PDE5 inhibitors and heart safety is that when combined with drugs called nitrates, they can cause a sudden drop in blood pressure, which can lead to dizziness, fainting, or even heart attack or stroke. Nitrates are contained in drugs used to treat cardiac chest pain called angina, including nitroglycerin tablets, nitrospray, or nitropatch. They are also an ingredient of the recreational drug amyl nitrate, also known as poppers. If you have any questions about nitrates and are unsure if you are using one, talk to your doctor. Having said this, it follows that if you have ischemic heart disease, meaning a history of heart attacks or chest pain called angina, and/or carry nitroglycerin or other nitrates with you, you must not take PDE5 inhibitors. Similarly, if you develop chest pain and have recently taken a PDE5 inhibitor, do not take nitrates, and notify emergency medical services that you have taken such a pill. In order to proceed, please click on the Continue button to indicate that you understand this important information. As mentioned earlier, PDE5 inhibitors combined with a class of drug called alpha blockers can also lead to a drop in blood pressure. These medications are also used to treat prostate symptoms in men. Ask your doctor about this if you are taking medication for your prostate. It is also recommended that you talk to your doctor if you take any of the following drugs: the heart rhythm medications amiodarone, sotalol, quinidine, or procainamide, the antibiotic erythromycin, the HIV medications indinavir or ritonavir, the antifungal drugs ketoconazole or itraconazole, or the tuberculosis drug rifampin. Furthermore, before taking a PDE5 inhibitor, speak with your doctor if you have any of the following conditions: kidney failure requiring dialysis, liver failure, blood disorders such as lymphoma or leukemia, stomach ulcers, previous prolonged erections lasting more than 4 hours called priapism, deformation of the penis such as curvature to the penis called Peyronie's disease, or a rare eye condition called retinitis pigmentosa. Another myth that has caused some men to fear the use of PDE5 inhibitors is that they might go blind if they take them. It is true that these medications can be associated with some mild and temporary visual effects, such as blue tinting to the vision. However, they do not cause blindness. There have been a few case reports published with a very few high-risk patients on PDE5 inhibitors experiencing rare cases of a certain type of blindness called non-arteritic anterior ischemic optic neuropathy. These men, however, had medical conditions that put them at high risk of this condition, and their blindness was not likely related to the use of PDE5 inhibitors. If you are not satisfied with the results you achieve using a PDE5 inhibitor, firstly, do not despair. Keep trying and focus on just relaxing and enjoying the experience. If you are still unsatisfied, talk to your doctor. He or she will review your use of the medication, the type and dose that you are taking, and review the issues around taking it. You will need to continue to work on lifestyle changes, such as diet, exercise, smoking cessation, and correcting other medical conditions. Next, your doctor will review the options with you, which might include increasing the dose of the medication, trying a different one, or adding a second, or moving on to a so-called second-line treatment. These include topical medications, injections, and vacuum devices. In summary, oral therapies for ED are highly effective, well tolerated, and the most convenient treatment for most men. It is very important to understand how to effectively use these medications, what the possible side effects are, and when they should not be used. This slide lists some of the many resources available where you can find more information about erectile dysfunction. These references were also used to assist in preparing this presentation. We sincerely hope that this module has furthered your understanding of erectile dysfunction. We wish you the best for the future, and thank you once again for viewing this educational program.